Hey, it's Chris with Rowe Dental Laboratory, and we have a very special guest today. We've been working with her and her company for a while now, and we have Joanne Villani from PreVu software. And we're going to learn a little bit about how this software can help close cases, big aesthetic cases, small aesthetic cases. Overall, it's a great software. Like I said, we've been using it for a long time. So for what types of patient scenarios is PreVu available?
So this is really an interesting question because a lot of times when practices come to us that are doing full arch, they want to really pigeonhole this to their full arch cases, or they want to use this almost exclusively for patients who ask about a treatment and it's expensive maybe, and they just feel like the person would do it if they used a PreVu and it would just give them that little push to move forward.
Right.
And that is absolutely what we do, but there are so many other opportunities to use it to help patients. So for example, a lot of offices are doing new patient marketing. A patient comes in, you have no existing doctor-patient relationship with them. How do you build trust really quickly? We have offices that tell us they wait a year and a half before they start talking about cosmetics.
Oh, wow.
Completely unnecessary.
Right.
You create a PreVu, you use it as what we call an educational mock-up. You can show people that their teeth have worn down over time. You can show people that their teeth are not in alignment and it might be affecting their gingival health and their overall health or their bite, and you're concerned about that. So in a new patient exam, it's extremely effective because again, it's really quick to create. So it's almost similar to using an intraoral camera to show people broken down amalgams and things like that. People will see it. It cuts down on the communication time because you can explain things really quickly and it gets people motivated. And also for a new patient, you want to make sure that you really they have a great experience in the office. So lots of reasons to use it in a new patient appointment, to especially plant seeds. And again, just generating that trust much quicker. But then hygiene, 60 to 70% of production comes through hygiene. And we feel like what you do today in your practice is absolutely going to affect your production tomorrow. So your hygienist should be using this either to re-engage patients who have been recommended treatment and they did not move forward. How do we talk to them about that? Sometimes if we don't have the communication skills, we feel a little uncomfortable, but how do we re-engage them? PreVu can help to do that. And even more importantly, what about those patients where they have a need, they would benefit from aesthetic or reconstructive dentistry, but the conversation never happened because we really didn't get I hear this all the time, we didn't get the vibe that they were interested. We didn't want to sell to them. We don't want to be salespeople. We don't want to offend them. If they were interested, they would ask us. And we say, no, we are the dental professionals. We have got to show them what's possible. A smile says so much about a person, and it also in terms of how they feel about themselves and how other people perceive them. So we have to do right by our patients and we have to show them what we can do for them. And using PreVu in a hygiene appointment for people where we've never had those discussions can really be helpful to start those conversations. And then, of course, it's your high value consults, your marketing, or have someone come in and they are eligible for, implant retained dentures or a bigger cosmetic case. A lot of times, especially if that's not your patient to start with and they're coming in from marketing, they're probably doing a little shopping around. If you're going to spend $50,000 with a dentist, you're probably going to go visit a few of them. How do you differentiate your consult? Everyone has a CAT scan. Everyone has models that have implants in them. Differentiate your practice, show them the transformation, because people don't spend $50,000 to buy teeth. They're buying it to change their life. And if we can show them a simulation of what they can look like, they can envision what their life can be. And that is what triggers them to want to invest in their smile. So almost every patient who walks in a practice for some reason or another would benefit from seeing a PreVu, because a picture is worth 1,000 words.
All right, well, that's great information. Thank you so much for your time today. And please tell us how to get a hold of you. Website, email, what's the best way?
Yeah, so thanks for having me. This was fantastic. If you want to get a hold of us, you can go to our website, prevudental.com, Prevu dental.com. You can schedule a demo. There'll be a link right there, or just go down to the footer. Our email is there, our phone number is there. You can even reach us through chat on the website if you'd like someone to reach out to you. So we're pretty easy to find and get a hold of, and we'd love to talk to you.
Awesome. Well, thank you so much. And listen, if you guys don't want to reach out to PreVu right away, please feel free. Contact us here at Row, and we're gonna get you there anyway. But if you have any questions on it, of course, definitely go to their site. But if you want to give us a call and talk through kind of what we've done over the years, we would love to have the conversation. So again, thank you so much.
Thank you. Thanks, Chris.